All right. Hey, guys, everyone. Thanks for joining. I'm Rob Tatro, president and founder of the Canadian CMV Foundation. Welcome to the CMV Checkup. This is now our third episode. Pretty thrilled to have our guest today. He's kind of a big deal, kind of a huge, I'd say a really, really big deal in the CMV space. We're proud to have him here in Canada. He's been doing research here now for a while. I've known him, I don't know, I want to say maybe 10 years or so. Dr. Soren Gantt, Pediatric Infectious Disease Specialist. Welcome to the CMV Checkup, and thank you kindly for joining us today.
Thank you, Rob. It's nice to be here.
All right, a couple items on our agenda today. First of all, I'd like to tag, June 2020 is CMV Awareness Month. As you know, we've been doing a lot, the CMV Canada and the Canadian CMV Foundation. What's your take on CMV awareness and what we're trying to do here, parents are trying to do to kind of raise awareness? What are your thoughts about, CMV Awareness Month generally?
Well, I think CMV awareness is absolutely critical. Congenital CMV is a huge problem, and awareness helps address that problem in a few different ways. One really important way is just preventing the infection in the first place, right? So most people have never heard of CMV. Most pregnant women never are told about the risks of CMV or how it's transmitted. And so education and awareness around the virus and taking steps to prevent infection during pregnancy, good hand washing, especially after handling diapers or saliva of little kids, not getting little kids' saliva in your mouth. These kinds of things is huge, and so prevention is a really important part of awareness.
Hey, on that point, do you think we're going to see a change because of COVID? Do you think we're going to see a change in people's behaviors, which will indirectly impact the transmission rate, or sorry, I should say the prevalence rate of CMV infections?
Well, I would be willing to bet that we're already seeing it in terms of
less CMV infections, congenital CMV infections.
Well, I mean, time will tell, but these same kind of hygienic precautions, frequent hand washing, that are good for preventing COVID, and perhaps distancing from other people's kids, things like that, will almost certainly reduce the risk of CMV transmission. We've already seen a decrease in transmission of other viruses. Influenza transmission just absolutely stopped as a result of the COVID-19 pandemic and the interventions, social interventions, and policies around that. So I think in the short term, it's very likely that there will be a significant impact on CMV transmission during the period that those interventions are in place. I think the bigger question is, once we get the pandemic under control, what will the new normal be? And will these kinds of behaviors persist and have a lasting impact on CMV? One hopes so, but I think human nature is such that people forget, and if it's not in the forefront of your mind, then it doesn't really happen. And so I think there might be some benefit there. I think in the long term, it's going to require vigilance about being aware of CMV and taking these steps. And there's some other similarities in the sense that, until we have a CMV vaccine, these kinds of behavioral measures and educational measures are going to be absolutely essential.
That's all we have, right? Like, we don't have the vaccine. So, I mean, we have valganciclovir to treat, or ganciclovir to treat, but like to prevent, this is our best approach, right?
Currently, yeah. So that's the other similarity, I think, with COVID-19. Yeah.
I'm Rob Tatro. I'm here on the CMV Checkup with Dr. Soren Gantt, Pediatric Infectious Disease Specialist. If you're watching on YouTube, please take a second to subscribe to our channel. If you're watching on Facebook, please follow and like. You'll be made aware of everything that's happening in June. June is CMV Awareness Month, as Dr. Gantt mentioned, an extremely important month for raising awareness, which, as he mentioned just now, is an incredibly important stage. We know that only, whether it's 10 or 15 or 20% of adults know about CMV. So we are here trying to do our best to raise awareness. You have done remarkable work in the last, how many years? Like, how many years have you dedicated to CMV? I feel like it's a lot.
Yeah, I mean, I've been working on CMV for about 12 years now, and a lot has changed, and a lot that has changed is due to increased awareness and proactive efforts on the part of families who know about CMV. Typically, unfortunately, because they've had an affected kid, but that awareness has really done immeasurable benefit for promoting CMV research, for putting in place policies and sometimes laws that promote CMV education and testing of newborns to allow optimal care. So, awareness it's impossible to overstate how important it is for CMV.
Well, thank you for saying that. We're going to continue to do what we do here at CMV Canada and the Canadian CMV Foundation to raise awareness. If you're a parent out there and you're watching and you want to get involved, now's the time. Get involved. You don't have to spend 1,000 hours to the cause. You can just spend a bit of time to maybe lobby locally. You can write your local minister of health. You can get involved with us to help spread the word. You can we got these really neat these one-pagers that are put in an obstetrician gynecologist office and clinics. There's a lot of ways you could help if you're a parent. You truly are one of the leading minds on CMV globally. I know it firsthand because I've been to I don't know how many of these conferences, and you're always speaking at the plenaries. You're always speaking about the research you've done. Incredibly well respected. I know you've Lindsay Craig, who was one of the parents that was on the show the other day, told us the story. She picked up the phone, called you out of the blue, and you helped her tremendously, and she ended up getting a diagnosis for CMV just in time to treat her child. So you've been very, very good and kind to the CMV community. You wrote the study recently on cost effectiveness of universal screening. So before I ask you about that, as a reminder, we believe universal screening needs to happen. Every single baby in Canada needs to be screened universally. The one concern that we had a few years ago or 10 years ago was cost effectiveness. It's going to be extremely costly to screen babies. And you went ahead and did the research on this. Do you mind just sharing with our viewers kind of roughly what your findings were?
Yeah, I mean, the bottom line is it's cost effective. The reason we did this study is because, as a physician, I see a lot of babies who are harmed by congenital CMV infection. We know that most babies who are infected and most babies who are harmed by congenital CMV are not diagnosed clinically, meaning the doctors or midwives or nurses or parents don't suspect that there's something wrong with their baby at birth, and therefore they're not diagnosed. And we know that there are things that we can do to help babies with congenital CMV if we know they're infected at birth. We know that they can be treated with valganciclovir if they have symptoms. And we know even before we had valganciclovir, we knew that we can pick up hearing loss earlier if we know that. And
intervention is the key in hearing loss, right? Like early detection, then you can intervene and improve the outcome.
Yeah, exactly. That's exactly right. Rather than waiting until a kid is 2 or 3 years old and isn't talking, if you know they have hearing loss in the first 3, 6, 12 months of life, you can use hearing aids or cochlear implants, speech language pathology, all these things to help them achieve their optimal speech language outcomes, educational outcomes, and all these other things. But so to me, it was obvious that kids should be screened. And even though I think that there was broad consensus on the medical benefit of screening, that people always will find reasons not to do something if they don't want to do them. And I think the big reluctance to take up, an ambitious program like universal newborn CMV screening at the time was, well, it's going to cost too much. You're going to find so many kids who are positive. We're going to have to do all this follow-up and all this testing and all this treatment, and it's probably going to be way too expensive. And what we did was,
heaven forbid we identify kids that we know are going to have issues later on in life. Heaven forbid we do what our job is as a healthcare system and identify these babies and then treat them and give them better outcomes and bring comfort to the parents. Sorry, but I'm a parent, so I'm allowed to say this.
It's exactly right. I mean, I agree with you. And I think the argument that it's so common is why we shouldn't screen, to me, was on its face just illogical, and so I decided with Karen Fowler and Suresh Bopanna and others that this was a relatively straightforward analysis to do. We have all the data, and it just took a little elbow grease. But when I initially approached a health economist to help me address the question, Francois Dion, I gave him the sort of, elevator speech version of it, the ballpark numbers and what we were interested in. And he said, I can tell you right now that's cost effective because hearing loss is so expensive, right? And anything that you can do to reduce the burden of hearing loss in these kids and to society is extremely valuable. And I'll note that, as you know, in that study, we did not include any other costs associated with congenital CMV disease, like intellectual disability, motor disabilities, visual disabilities. We know more about vestibular problem, balance problems, and things like that. And so this is really, I think, a very conservative estimate about how cost beneficial universal screening is.
You heard it here, folks. Universal testing for congenital CM virus infections is cost effective, period. It's a great study. I've read it multiple times. I actually had to dissect it quite a bit because in February, March, we actually presented some of your findings to the Alberta government in their efforts to take a look at universal screening. As you know, it's happening in Ontario already. Ontario is the first place on earth to basically do universal screening, as I understand it. And we have a whole bunch of other provinces where they're looking at this really closely. It is going to happen everywhere, guys. Mark my word, with the parents working tirelessly to make this happen, with guys like Dr. Soren Gantt and some of the other awesome experts in the Canadian community, as well as some of the names you mentioned. Dr. Karen Fowler, she's awesome. She was on my show. She was on the Tatro show a while back. She's great. Dr. Bopanna, he's cool too. Really good people in the CMV community. And it's too bad that we're not going to get to see them in Ottawa in 2020. I want to touch briefly on, you and I were co-chairs. Myself and Dr. Jessica Dunn were co-chairs for the Ottawa 2020 conference. This was supposed to be the first time that the Public Health and Policy Conference was going to be held outside of the US ever. And it was going to be held in the lovely city of Ottawa. And then COVID happened. So we were working hard to make that happen. You and I and Jess and the entire team, the parents, the doctors, the medical advisory committee, everyone. We just announced it last week, but how do you feel about it moving back a year? And overall, you must be kind of excited that it's still going to happen in Ottawa, and we're just going to reload and retool and make it happen in 2021.
Yeah, you said it. What can you do? The pandemic is, it's terrible. It's affected every part of everyone's life for the most part. And I'm sad that we're not able to have it as scheduled, but I'm glad that we'll be able to do it here at some point. I think the idea of doing a virtual meeting, a scaled down virtual meeting, is a great short-term solution, and I think it's really important to have this meeting in Ottawa as soon as we can do it, because of all the great things that are happening in Canada in terms of congenital CMV research and policy, and the screening program in Ontario. The world's really looking to that program to see what works and what doesn't work, and how can we take the ball and move it forward.
I think you said it, you hit it the nail on the head. The world is really looking to us here. And I think if you're a Canadian parent and you're not deeply involved in this, like I am, you might be wondering, I didn't know. Like we're not exaggerating here. Canada is at the forefront globally of what is happening in the CMV space. We do need to get some funding dollars. We need CIHR to step up and give us some funding dollars to see kind of the impacts and the outcomes that is happening in Ontario right now. A lot of really neat research that's happening across the country. What are you working on right now? I don't know if I know. What are you got going on these days?
Well, without being a downer here, Rob, I'm not really working on much at the moment other than COVID-19.
Right. Yeah. Your time is being moved there, obviously.
And there are some good reasons for that and some bad reasons for that. Obviously, COVID-19 is a huge problem, and we need all hands on deck to try and stop the pandemic as soon as possible. It has put everything else on hold. So the same way, non-essential work in other fields has been curtailed or stopped. For the most part, CMV research, along with other non-COVID related research, has been deemed non-essential. And that means that all of our research projects, most all of them, have been put on hold. And so that's a kind of a double whammy, right? So not only are people being hurt by COVID-19 directly, but people are being hurt indirectly by virtue of not being able to continue to try and solve these problems that are still affecting our kids and will continue to do so even after the pandemic is over. I will say that I'm frustrated in some ways, similarly to when the Zika virus epidemic occurred, that governments are able to come up with large sums of money and fast track vaccines and funding for problems that they deem acutely problematic, but things like CMV that have always been a problem, and the magnitude of things like CMV are comparable. If not greater than, for example, Zika.
How many congenital Zika infections did we actually get in Canada?
None.
Zero, right? The number is zero?
Yeah.
It's like a handful in North America or something like that?
Yeah, well, there were none acquired in Canada because of the epidemiology of the mosquito vector and things like that. I'm not entirely sure that we had none. There may have been some travel related. There were definitely numerous travel related and infections acquired at home in the United States. But the total number that we're talking about, even worldwide, is a tiny fraction of what we're talking about for CMV, and that's since time immemorial and still ongoing. And so we've got no Zika anymore, right?
Yeah, every day, every week, there's kids every single day that are born with congenital CMV. Yeah. Some are symptomatic, some are asymptomatic. Most do not get diagnosed. Most get missed. Our healthcare system, even though you called it, I believe, standard of care, where a child fails a newborn hearing screening. If you're a parent and your child fails their newborn hearing screening, and you're in a province where they don't automatically test you for CMV, please, you need to ask your healthcare provider. Like, I remember you telling me that shouldn't be, we shouldn't have to ask for that. Like, if the most common cause of non-hereditary hearing loss is CMV, why wouldn't we test for that? Why wouldn't we test for CMV if a child fails his newborn hearing screening? Anyways, I have some strong opinions on this. Obviously, I think we need to do way better.
And we need more money. We need more money for research. We need more money for programs. Donating to foundations like yours that do good work is really important. lobbying the government to devote more money to CMV research is also really important. I mean, CMV was ranked the #1 most important vaccine development goal by the United States Institute of Medicine 20 years ago. And so, if you think about how research dollars are prioritized, it's out of whack. And I think, obviously, there are lots of important public health problems and medical problems and things that affect kids. But I'm not alone in saying that CMV is grossly underfunded relative to the importance it has for the impact on our children.
There's just so many kids, and the impact on the kids is so serious. Like, loss of hearing is an expensive what were the numbers, like 400 grand or 800 grand? I forget what it is, but it's a significant, it's a significant burden on the healthcare system over the course of a child who can't hear. And I mean, we have a way to screen for them, identify them, treat them. Like, I'm convinced it's going to happen, Dr. Gantt. And you're one of the good guys who's working hard to make this happen. I want to thank you, guys. We're here live with Dr. Soren Gantt, pediatric infectious disease specialist, in the process of moving to the Saint Justine Hospital in Montreal. Congrats on that.
Thank you.
That's a fantastic center. I actually talked about it in one of our shows, one of the CMV checkups, how I think it's like the gold standard, how they operate there. It's just fantastic. I was at the grand opening with Dr. Fatima Kakar and Isabelle Bouquarin, and just a great team over there. Good for you. I'm happy for you. I'm kind of sad that you're leaving Children's in BC, because you got big shoes to fill over there, but I understand what you're doing. It's great. I wish you all the best. We're here live on the CMV Checkup. Join us throughout the month of June. We will be doing these types of shows, hopefully get some more pediatric infectious disease specialists, hearing experts, audiologists, ophthalmologists, whatever, and parents. If you're a parent, we want to hear your story. So by all means, reach out to us. Go to our website, cmvcanada.com, fill out the consultation form. We'd love to hear from you if you're a CMV parent. Like our YouTube page, like our Facebook page, and thank you for tuning in. Dr. Soren Gantt, thank you for your time. Thanks, everyone.